Imagine this: you wake up, look in the mirror, and the first thing you see is red, scaly patches on your skin that just won't go away. They itch, they burn, and they've been there for as long as you can remember. This is the reality for millions of people dealing with psoriasis. And while there are treatments out there, finding one that actually works and doesn't make things worse can feel like an endless quest. But one treatment has been around for decades, often recommended by doctors, called Anthralin. In this video, we're diving deep into Anthralin, how it works, and what you need to know before using it. Stick around, because understanding this treatment could mean finally finding a way to take back control over your skin. What is psoriasis? Let's start with the basics. Psoriasis is a chronic, inflammatory skin disease. That means it doesn't go away, but it comes and goes, creating flare-ups that can last days or even months. During a flare-up, people experience raised patches on their skin that can be red, purple, or even silvery. Psoriasis affects more than 8 million people in the US alone, so if you're living with it, you're definitely not alone. Why psoriasis flare-ups happen? Psoriasis is caused by an overactive immune system that speeds up skin cell growth. Normally, skin cells grow and shed over a month, but in psoriasis, this process happens in just a few days. As these cells build up, they form the thick, scaly patches characteristic of psoriasis. Factors like stress, infections, and even certain medications can trigger flare-ups, but each person's experience with psoriasis is unique. Introducing Anthralin now, let's talk about Anthralin. Anthralin is a synthetic version of a natural substance found in a type of dried tree sap known as guava powder. It's been used to treat psoriasis for over 80 years, so it has a long track record. Unlike other common psoriasis treatments, Anthralin doesn't contain steroids or coal tar. Instead, it works by slowing down the rapid growth of skin cells and reducing inflammation. How Anthralin works? Anthralin's magic lies in its ability to reduce the speed of skin cell growth. It doesn't cure psoriasis, but it helps manage symptoms, especially during those difficult flare-ups. But remember, while Anthralin can work wonders, it's not a one-size-fits-all solution. It has its own set of benefits, precautions, and potential side effects. Different ways to use Anthralin. Anthralin comes in a few forms: a cream, an ointment, or even a shampoo for scalp psoriasis. Let's look at the two main ways you can use it. 1. Short contact treatment. In short contact treatment, you apply Anthralin to the affected areas for a brief period, usually between 10 and 30 minutes, and then wash it off. This process can be repeated over several days or weeks, based on your doctor's instructions. Short contact treatment is great for people who might be sensitive to the medication and want to reduce the risk of side effects. 2. Overnight treatment. For more stubborn patches, you might leave Anthralin on overnight. After applying it to the areas affected by psoriasis, you'll wash it off the next morning. It's an easy way to let the medication work while you sleep, but it also increases the risk of skin irritation. 3. Anthralin shampoo. If your scalp is affected, you can use Anthralin shampoo. Just be sure to avoid getting it in your eyes because it can irritate them. If it does get in your eyes, rinse thoroughly with water to prevent any damage. Using Anthralin, precautions and tips. While Anthralin can be effective, there are some precautions you should be aware of. Here's a quick rundown. 1. Only use as directed. It's essential to follow your doctor's instructions. Using too much Anthralin or leaving it on for too long can increase the chances of side effects. If you have questions about your dosage or treatment plan, don't hesitate to ask your doctor. 2. Protect your eyes, nose, and mouth. Anthralin can be irritating, so try to avoid getting it in your eyes or on the inside of your nose or mouth. Some people choose to wear plastic gloves while applying it, which can make cleanup easier and reduce the risk of accidental transfer. 3. Avoid irritated skin and sensitive areas. Anthralin isn't meant for raw or blistered skin, or for sensitive areas like the genitals or the creases of your body. If your psoriasis affects these areas, talk to your doctor about alternative treatments. 4. Be mindful of staining. This one's important. Anthralin can stain your skin, clothes, and bed linens, so consider using a protective dressing and make sure to rinse out the bath or shower after washing it off. This can help keep your bathroom and wardrobe stain-free. Possible side effects of Anthralin. As with any medication, there are potential side effects. Common side effects include skin irritation. Anthralin can cause burning, itching, or discoloration, especially if it comes into contact with unaffected skin. Staining. Aside from clothing, Anthralin can also stain the skin temporarily, so don't be surprised if your skin looks a little darker after treatment. In rare cases, people may have an allergic reaction. Symptoms of a serious allergic reaction include a rash, itching, severe dizziness, or difficulty breathing. If you experience any of these, seek emergency help right away. Dealing with common concerns. We get it. Dealing with a chronic condition like psoriasis can feel isolating and overwhelming. If you're concerned about side effects, or if you've been frustrated by treatments in the past, you're not alone. Many people with psoriasis feel the same way. The key is to work closely with your healthcare provider to find a treatment plan that fits your lifestyle and addresses your specific symptoms. Finding your path to clearer skin. Psoriasis may not have a cure, but treatments like Anthralin can make a real difference. With the right approach and a little patience, you can manage flare-ups and reduce symptoms. Just remember, consistency is queen when it comes to managing psoriasis. Stick to your treatment plan, stay informed, and keep the lines of communication open with your doctor. Conclusion: living with psoriasis can be challenging, but understanding your treatment options is a powerful first step. Anthralin might just be the right choice for you, especially if you're looking for a non-steroidal treatment. While there are side effects to watch out for, knowing how to use the medication safely can make a world of difference. Thanks for watching, and remember, if you're experiencing psoriasis, you're not alone, and you don't have to face it alone. There are treatments, resources, and a community out there ready to support you. If you found this video helpful, please like, share, and subscribe for more content on living well with chronic conditions. And until next time, take care of yourself and your skin.